Welcome back to another episode of Spilling the Tea with Dr. T and Gabriel.
G
Gee,
and Lavali. And this isn't just another episode
this is a new season.
of the
Ta-da!
season. And we have a new color. The color for this season is
Purple.
the color purple. Why not?
Why not?
Why not? So here we are, back again to dive into some more men's health related topics.
Ooh.
And today we're going to be discussing one that a lot of patients come to me to discuss and with concerns about. It's certainly one of the symptoms of having low testosterone. So working in men's health and the TRT space, a lot of patients have this issue and ask me, how can they boost their sex drive, or how can they improve their libido or sex drive?
All right, let's start with the basics. Why is the male sex drive so important?
So the male sex drive is a complex process affecting sexual arousal. And of course, it's going to impact many different areas of a man's health. So of course, we think reproduction. How are you going to reproduce if you're not able to be aroused and to participate in sex? Of course, you have to get the engine started before it gets moving. And so there's definitely going to be a lot of importance there. Then we consider relationships. So if you are evolving into a more committed or serious relationship, or if you're just looking to have a fun-based relationship with someone, you're going to need to be aroused to participate in that fun. We even see it as a big part of stress reduction. So most men don't get as much physical activity as they should, but sexual activity does add into that. So sex can be a great, healthy way to get your cardio in. So it's also going to help reduce stress and improve physical activity. We also know that sex, of course, is really important with the development of our emotional health. So bonding, it helps to reduce anxiety and the risk of depression, and then self-esteem. So we know that men who have more sex typically have a higher sense of self-esteem, unless they have some sort of addiction problem. And of course, we can put an asterisk there and say all these things where there can be anything that causes pleasure can result in addiction, and there is sexual addiction. But for the majority of men who have a healthy sex life, they tend to be happier, and they tend to be healthier and live longer lives and at a reduced risk for mental health concerns. And that's just what the clinical evidence shows us. So all these benefits tie in to having a healthy sex drive.
Sex is everything.
It can be, it definitely is one of those basic fundamentals of being alive. You eat and sleep, you poop, you have sex, you repeat.
Basics.
The basics. And some people, unfortunately, don't get to enjoy the basics because there can be a lot of reasons for factors that impact their sex drive and make it less functional than it should be. And of course, we're going to get into that.
So what is the definition of the male sex drive?
So the male sex drive, or our libido, is that natural sort of instinctive drive that pushes us towards sexual activities and sexual arousal. Of course, we need the ignition started before we can get moving, like I mentioned before. And so this is sort of that igniter, like getting us ready and prepared for sexual intercourse. Many different things can influence what makes our libido go higher or lower. And we also know that the libido fluctuates throughout our lifetime as well as from person to person. So even though some people can be the same age, they can have completely different libidos based on their genetics, their hormones, other things we're going to get into. And then we do know, again, as we get older, our libido is likely to decrease in correlation with hormonal changes, genetics, things like that. Of course, we also know the libido is super important in how we establish and maintain our relationships. And so that's going to be a huge component to what really defines what the sex drive or libido is for men. In regards to our psychological well-being, clinical evidence has shown on many different studies that people who have a higher sex drive and are engaging in sexual activities in a safe and comfortable way tend to have lower instances of stress, anxiety, and depression. They report that they feel a higher quality of life. And we also see that it just impacts them beyond just the physical and into their mental health. In regards to our physical health, we know having a higher sex drive or libido is going to impact our physical activity because it is a form of cardio. So there is clinical evidence that people who have sex more often are typically seeing the results of that fitness. So we're going to have a lower instance of high blood pressure, cardiovascular disease, and it can even impact their immune function and make their immune system stronger.
Wow, sex is cardio. Let's just say
Sex
that.
is cardio for sure. And then, of course, when thinking of relationship satisfaction, sex can be an important part of bonding between people in a relationship, of course, you're sharing intimacy, you're sharing an emotional connection. And that's not for everyone. Not everyone has the same view on sex in the relationship, but clinical evidence has shown that a stronger sexual connection typically leads to higher levels of bonding, higher levels of overall satisfaction within a relationship. So we do know that there is a clinical correlation to having more sex, meaning your relationship is typically better.
I agree. It's good. I think everyone agrees with that.
Yeah, you'll have to give that person that you're with some feedback. I'm sure they'll love to hear it.
Yeah.
We also know that having a higher sex drive is important for our hormonal balance. When sex is being undertaken, a lot of different chemicals are being released in the brain, things like dopamine, oxytocin, serotonin. All these neurotransmitters release a sense of pleasure. And for people out there who have higher levels of these released neurotransmitters, clinical evidence shows that they are typically happier and report a higher sense of overall happiness within their life. So again, another reason why having more sex means you're having more of those good and pleasurable chemicals being released. And over time, that adds into you just feeling better about your overall quality of life.
I'm shocked. I didn't think sex was so impactful when it comes to health and happiness.
I know. Usually people think it's just about the immediate pleasure, and absolutely that is an important part of it, but it can be really bonding. There's a lot of physical benefits. There's a lot of mental benefits.
Everything's at stake
Yeah,
here.
we got more to discuss.
Ooh.
So hang on tight. We also know that having a higher sex drive has been linked to having a higher self-esteem because people typically feel better about themselves. They're able to perform better. And of course, sexual activity again releases a lot of those positive neurotransmitters. So we are seeing people with higher dopamine levels, higher serotonin. These are the feel-good hormones. And when you're feeling good, you're typically feeling self-confident too. And so again, that's not for everyone. I'm not saying going out and having more sex is going to make you more confident. That is not the purpose of this discussion. The purpose is that there is a clinical correlation to, in general, having a higher sex drive. These people can have a higher sex drive again because hormonal influences, genetics, their lifestyle, and those things all add together, which likely result in higher self-esteem. It's not just having more sex equals higher self-esteem. That is not what I mean, just so that's out there. And of course, after you're done having sex, one of the things that people most commonly do is fall asleep. So we do know that there is clinical evidence to show that higher sex drives typically result in people having a better quality of sleep and sleep satisfaction. There's some clinical studies that were done to see how people ranked their quality of sleep, and they also ranked how high their sexual activity was. And there was higher satisfaction in sleep when there was higher sexual activity. Again, I'm not saying increasing your sex drive or having more sex is going to mean that you're going to have better sleep, but there is a clinical correlation there. It's not causation. It's not you do this and then here's your result. It's more like we know that there's these two things that are correlated and that it does align with having a higher sex drive. Typically, those people have better sleep.
I mean, that makes sense. I get sleepy.
Sleepy is definitely a good feeling after you've sort of completed your business.
Time to rest and relax.
Yeah, and there's a lot of chemicals again released from the brain after you finish that say, great job, time to rest, recover, rejuvenate for next time.
Get ready for the next time.
Especially for men, we have this refractory period. So after we reach climax, all of those neurotransmitters are saying, all right, there's nothing else for you to do here. Take a nap. Whereas for females, it's much different.
Right.
They don't have a refractory period as long as ours. So they're able to kind of be ready to go again much faster. And last but not least, we do see that higher instances of sexual activity secondary to having a higher libido can impact our physical health, specifically our immune system. There is some clinical evidence to show that sexual activity can actually stimulate more antibodies to be produced, which are the protective proteins that float around our bloodstream, protecting us from bacteria, viruses, and all the other agents that can cause disease. And so we do know there's a correlation there as well. So really, sex is really good for you.
That's crazy. Even like the immune system, that's I didn't know that, obviously.
Yeah, it's so interesting how many things can be tightly
linked together.
Exactly. You don't think that having sex is going to impact your
sleep, immune system, hormones.
Exactly.
You only think superficially, but actually it's much bigger than that.
Right. And you think, again, why would this be such an innate biological function, right? Why is it so easy for us to literally eat, sleep, poop, and have sex. And all those things are good for us. All those things also can, well, other than one of them, can be overdone, right? You can eat too much, you can sleep too much, and you can have sex too much. So there is such a thing where you can overdo it,
Right.
resulting in consequences. But in general, a healthy and well-balanced sex drive is going to be a major positive to your overall health.
That makes sense. I mean, if you have good sleep, healthy sex life, and you eat well, I guess you're
doing good.
You're doing really good. You're happy.
You're happy
and healthy.
Yes, exactly.
So let's understand more about the male sex drive. What biological factors impact the libido?
Right. So our sex drive, per biology, is impacted by our hormones, our neurotransmitters like that dopamine, serotonin, oxytocin we were talking about, as well as our genetic factors. So all these things come into play to determine what our sex drive is going to look like and why it may be different from those around us or change as we get older.
So what are the hormones that influence our libido?
Right. So our hormones play a pivotal role in managing and maintaining our sex drive. And of course, the most important hormone in this space is going to be testosterone, especially for men.
Has to be the T.
Has to be the T.
It's always the T, as you can see.
Wow, G.
Yeah, lovely.
This is our first mixtape.
A demo.
It's a demo. It's an EP.
So why the T? Why testosterone is the most important hormone?
So testosterone is going to impact our sex drive through affecting our brain as well as our nervous system and the billions, if not trillions, of testosterone receptors all throughout the body. Of course, testosterone is a major impactor on our mood and our energy levels. And of course, that's going to also come into play with our sex drive.
Testosterone is everything.
It's everywhere.
Everywhere. Cannot escape.
In regards to brain activity, testosterone is going to impact and stimulate 3 different areas of the brain that are responsible for our sexual desire as well as our arousal state. So first up, testosterone is going to stimulate an area called the medial preoptic area. And this is actually part of the hypothalamus. The hypothalamus is kind of like command central of our brain. It maintains our weight. It maintains our body temperature. So a lot of important functions there. And there are some testosterone receptors in this area. Once they're stimulated, they're going to release lots of dopamine, which again is going to be that pleasure neurotransmitter that results in us feeling great. So we do know testosterone is going to signal there and create an increase in our arousal state. Next up, we know testosterone is going to stimulate an area in the brain called the nucleus accumbens. And so this area is really important in stimulating the response for reward as well as pleasure. We also know this area is important in creating motivation. And that's why we know testosterone not only is going to impact our sex drive, but can help us to increase our motivation and feel more self-confident and have that reward sensation. Of course, the release of the neurotransmitter dopamine is also going to be happening here. Dopamine, again, is that pleasure chemical that reinforces us to do things over and over again.
There it is.
There dopamine. It is. It's all about the dopamine.
We know her.
And finally, we have the amygdala. This is a part of the brain that's kind of famous. I think people have heard of it before, but it's important for how we process emotion and sexual desire. So testosterone is going to stimulate the receptors there, again, kind of heightening our sexual desire and as well as creating emotional bonds, which of course is important with our sexual activity as well.
I like amygdala.
Yeah, it's a fun word. It's spelled amygdala.
In Portuguese, friend is amiga, so it's amiga, amygdala.
Interesting.
Yeah.
So the amiga is the amygdala.
It's a friend.
Why not?
Emotional. I won't forget.
You'll never forget.
Never forget.
Amy G.
So speaking of dopamine, will testosterone increase our dopamine?
Right. So when it comes from the neurotransmitter response from testosterone, we do know that higher optimal levels of testosterone as they act on the central and peripheral nervous system result in a higher increased release of dopamine. And of course, dopamine, again, is that pleasure neurotransmitter. It's also really important with energy levels, motivation. And so we do see clinical evidence that shows that higher testosterone values typically results in men having a higher sex drive, a higher motivation, overall sense of feeling happier about themselves and higher self-esteem. This is why we often see the opposite when men present with low testosterone. Of course, that lower testosterone is going to impact the amount of dopamine that's being released. Because that's less dopamine, men are often going to feel less motivated, have less energy, of course, less sexual desire. And again, typically reminds me, hey, we need to check your testosterone values to see how we can get you feeling better.
This is one of those things. Having low testosterone could cause low libido, and having
Right.
low libido can cause you. It's a
Yeah, a
domino
cycle.
effect.
Exactly.
Everything's linked.
Everything's linked.
So, are there testosterone receptors all over the body?
Yes, put simply. So there are billions, if not trillions, of hormonal receptors, specifically testosterone receptors, all over the body, which is why higher and lower levels of testosterone will have various physiological effects all over the body, including our sex drive. So we do know, of course, they're in muscle cells, they're in our brain, they are even aligning our gut. And so we do know that the hormones in our body make a major impact on pretty much every function that we do.
Wow, billions. That's a lot.
I think even more than that. I think it's more closely in the
That's
trillions.
crazy. And what is the relationship of testosterone with our mood?
Right. So there's going to be lots of testosterone receptors in the brain. We kind of talked about the main three areas where we do see some, specifically in regards to sexual arousal. But there are other places that are going to be waiting to respond to our hormones throughout the brain and affect our mood and energy levels. We see a clinical correlation where patients that have low testosterone are often going to feel symptoms of depression, anxiety, stress. And on the contrary, those that have optimal testosterone values are typically reporting symptoms of depression and anxiety much less. And so we do know that testosterone is a tight mood regulator. And so a lot of times when patients have low testosterone, that's one of their main concerns is I just don't quite feel myself. I feel gloomy. I don't quite feel depressed, but I just don't quite feel happy.
Right.
And so that's because hormones play a major impact in our mood.
So, what happens to our testosterone over time?
So over time, as we age, we're going to unfortunately see testosterone levels start to decrease. And that is because our genes start to get older and our body stops seeing testosterone production as a priority. Of course, the main goal in producing testosterone is to get us through puberty and to
Right.
allow us to evolve from young people into adults and to be sexually reproductive. And because that box gets checked when you end puberty, your body has other things to worry about. It's trying to keep you alive and focus on the most important functions that are going to keep you moving and your heart beating. And testosterone production just isn't usually a priority for all of us, especially if our genes put us at a increased risk of having low testosterone.
What are the causes for our testosterone to decrease?
So that can be due to many different factors. There can be physical reasons, mental health reasons, there can be environmental reasons. Of course, our genes play a heavy impact as well. So it really just begins with trying to determine what came first, your symptoms or the cause of your symptoms. You can look at things like your lifestyle initially to say, okay, what does my diet look like? How much am I exercising? What is my sleep quality? And then you can look beyond that into your genetics. Did anyone in my family have low testosterone? And beyond that, what medicines am I taking that may be impacting my hormones? So it's really dependent on the patient and the person and what symptoms they have and their medical history, because the cause of low testosterone is really vague and can be many different things. The most important thing to think about if you have symptoms of low testosterone is to determine how you can get yourself feeling better. Again, take a look at your lifestyle. Are there things you can change or adjust? If your symptoms are critical and really affecting you and your overall sense of self, your self-esteem, your relationship, talk to a medical provider. Tell them your symptoms, tell them your concerns, let them know you want to be tested for low testosterone, because there are medical interventions that can get you feeling better much quicker than waiting around for lifestyle changes to impact how you feel.
There's a solution.
There's always a
Yeah.
solution. Got to be positive.
So, other than dopamine, are there any other neurotransmitters that can impact in our sex drive?
That's going to be serotonin and
Mm.
oxytocin. So, dopamine, of course, is the main culprit. It is the pleasure chemical that is released and has probably the most powerful impact on our sex drive, our arousal state, libido. And of course, serotonin, a mood regulator, is extremely important in how our body and mind are able to reach an arousal state and feeling good in general. We do know that for those that have low serotonin, this is often seen in the diagnosis of depression or anxiety. And so men that have these diagnoses typically have a low sex drive. We also see that the treatment for these conditions, depression, anxiety, are by medications called SSRIs, or selective serotonin reuptake inhibitors. And while these can moderate or modulate our serotonin levels and help people improve their symptoms of depression or anxiety, it can often have a negative impact
Wow.
on our sex drive. And so we know that serotonin balance is really important and delicate in regards to maintaining a healthy sex drive.
So medication can influence all those neurotransmitters as well.
Right. And there are some SSRIs that can impact our sex drive
Wow.
and some that don't as much. So it's important that if you are on one of these medications and you're noticing your sex drive is not as healthy as it was in the past, talk to your doctor. They
Pay
can talk
attention to
about,
that.
yeah, different options that you can have prescribed that may not impact your sex drive as much. And then we have oxytocin. So oxytocin is actually known as the attachment chemical or the romance chemical. That's because it is released and allows for us to bond. It's actually considered one of the bonding hormones as well. And so we know this is a really impactful and important hormone to help regulate our sexual desire and our sexual satisfaction. However, there's not been a clinical study to show us that trying to modulate oxytocin has been very effective. So we're still seeing a lot of clinical evidence there to determine how we can use oxytocin to help improve our sex drive, but we do know that it is somehow involved.
I like oxytocin.
You're my oxytocin.
Oh.
Interestingly enough, this is one of the chemicals that is released to help mothers bond with their children as well
Ah.
after a child is born. It's also important with how mothers nurse. So,
Oh,
like the nursing sort of activity. But that's for a different talk
interesting.
on a different day.
Different season, different
Yeah,
video.
different channel.
Okay, so we know about the three neurotransmitters, and now let's talk about how our genes can impact our sex drive.
So we do know that genetic predispositions can significantly impact our sex drive, and that's for a multitude of reasons. So our genes are important with creating pretty much everything in our body. We know it's going to be responsible for maintaining and producing our adequate testosterone hormones, as well as any other sexual hormone. It's also going to be important in how much our body releases neurotransmitters. So our genes basically undermine any of our own sort of ideas or wants for ourselves. We're kind of stuck with them. And so, unfortunately, for some of us, this can be a reason why there is varying between sex drives among people who are the same age, who are following the same lifestyle, who are just as healthy as one another. You can really get to the microscopic level and to see the genes and determine whether this is a genetic problem or not. That being said, the majority of us still have quite an impactful way to influence our sex drive through our environment, as well as our diet, our mental and physical health. And so there are things we can do to try and combat some of these more genetic and difficult, sort of concrete reasons why our sex drive may be lower. But yeah, it really just makes the reason for why things can vary so much from person to person in regards to sex drive is because unfortunately our genes are a big predictor of what's going to be the outcome of how sexually active we feel or how sexually active we are.
Genes is the only things that we cannot change.
Yeah, I mean, they're working on it. Genetic therapies are underway, but I have a feeling they're not too concerned with using genetic therapy to enhance our sex drive, at least yet. You never know.
You never know. I'm sure people will be interested in that.
I'm sure there's a market for it.
Now that we talk about the biology, how do mental factors impact our sex drive?
Right. So the most powerful mental factors that are going to impact our sex drive are things like stress, anxiety, interpersonal relationship problems. All of those things, unfortunately, can have a negative impact, making our sex drive lower and making it less likely for us to get aroused.
Speaking of stress, how do relationship dynamics impact sex drive?
Right. So relationship dynamics can have a major impact on our sex drive. Just think about it. If you are not able to communicate effectively with your partner, or if you're not able to share an intimacy bond, if there is a difference in sexual appetite between two people, that's going to make a major impact on your self-esteem as well as your sex drive. And so it's important that when you do enter a relationship, that is a conversation that you have. Of course, you want to have open communication around sex. You want to talk about what your desires are, what your sexual appetite is like. That being said, you need to also be respectful of what the other person, of course, in your relationship is expecting from you as well. But if you are approaching sexual activity more frequently than your partner and being shut down, it can ultimately result in you feeling less desire over time. Of course, you can harbor that emotion and those frustrations, which then further deteriorates your sex drive. Because really, you need to be on the same page with your partner and open to communicating about your desires so that you can remain there. We often again see that patients that report having higher levels of communication and intimacy with their partner typically report that their relationships are more successful and happier and last longer. And again, I think it all boils down to communication and being open to discuss what your desires are. And so, again, if you are experiencing that problem with your relationship and you're not sure why you aren't able to get aroused or approach your partner sexually, it could be just due to communication and something to consider.
I think this is one of those cliches, but they make a lot of sense, right? Communication is key in that case. Relationships, issues, they will arise, and you have to be able to communicate with your partner about,
How to fix them
yeah,
and work together.
and work together.
That's the point. It's fun to work with you,
Aw.
partner.
Hmm.
Howdy, partner.
Are there any ways that we can boost our sex drive?
Yeah, so there are multiple different strategies you can approach boosting or increasing your sex drive with. Certainly, it depends on who you are, what could be causing your poor sex drive, as well as your medical history. But things you want to be aware of are your diet, your lifestyle factors, as well as whether you're taking medications or if you're interested in taking medications to help boost your sexual arousal state.
So, what dietary changes can impact our sex drive?
Yeah, so when it comes to diet, of course, we want to look at how much, processed food we're eating, how many fatty, fried foods we're eating. These things can always have a negative impact on our overall health as well as our hormone production. But things that are high in, of course, fruits, vegetables, those raw and unedited foods are going to be the most important things to add into your diet. In regards to the nutrients that we're looking for, zinc, vitamin D, omega-3 fatty acids are all really important with how our body is maintaining our hormones, as well as the things that can factor into our sex drive and sexual function. We do know that zinc is really important for testosterone production, as well as spermatogenesis, so the creation of sperm if you're trying to get your sex drive up and reproduce. We also know that vitamin D is going to enhance testosterone production and how our body's able to use testosterone. We also know that vitamin D is important with our mood and making sure we stay healthy as regards to supporting our immune system. When it comes to omega-3 fatty acids, these are really important to help reduce inflammation and to promote blood flow. We know that it's also impactful in ensuring blood is able to be delivered to the genitalia. We need adequate blood flow to have full, firm, and effective erections, which is of course going to support and further reinforce our sex drive. So incorporating foods high in these are going to be really helpful as well. And in general, just having a healthy, balanced diet is going to make an impact on our sex drive.
I didn't know if vitamin D impacted our mood.
Yeah, so that's why a lot of times when you have low vitamin D in the winter, when you're not in the sun as much, because we naturally get vitamin D through sun exposure, you can often feel like you have the winter blues or maybe impacting your mood.
What about alcohol and caffeine? How they impact our sex drive?
Right. So alcohol and caffeine both can impact our sex drive in different ways. Alcohol, of course, is a depressant. So it's going to work on the central nervous system to make us feel a little more drowsy, inebriated, and that can impact our sexual function and abilities. Of course, we do also know that chronic alcohol use can damage the liver. The liver is an important part of how our body excretes the female hormone estrogen, and having too much estrogen can result in a decrease in our libido. So all those things factor in. If your alcohol consumption is chronic or you have excessive alcohol consumption for a long period of time, it can impact your hormones and your sex drive in general. That being said, in moderation, alcohol is fine to consume. Similarly to caffeine, there's actually some clinical evidence that small doses of caffeine can actually increase your sex drive by getting the heart pumping, getting the blood flowing. But if you have too much, it can have the reverse effect. And of course, using caffeine on a long period or chronic basis also can increase your risk of anxiety and stress, which thus has a negative impact on our sex drive. So really looking back, alcohol and caffeine in moderation are okay, but if they become chronic issues, they can have a negative impact on our testosterone production as well as our sex drive.
So it's okay to have a shot of espresso before sex.
Absolutely. There's no harm there. In fact, it might help a little bit.
Enhances the experience.
Enhances the experience.
Just a little bit.
Just a smidget.
What about hydration? How does hydration impact things?
So of course, hydration is going to have an impact in pretty much every aspect of our lives, and it is important in our sex drive and our ability to get aroused. It's also important in our sexual function. We do need to maintain optimal, appropriate hydration so that we can avoid fatigue and, of course, keep that blood moving to where it needs to go. We need a lot of blood flow moving to the genitalia to create and maintain an erection. So having proper hydration and drinking lots of water before sex is going to be super beneficial. And then having proper hydration in general is going to help to maintain a healthy sex drive.
And also after sex, because you're gonna need a lot of water.
Definitely.
Like we said, sex is cardio. You're gonna need hydration.
Yeah, and it's funny you mentioned that. We're going to get into medication shortly, and one of the sort of important things to remember if you're taking in a medication to maintain or achieve an erection, like an ED medication, you want to maintain your hydration as well. A lot of patients, after taking one of those medications, because it can impact their blood pressure and move a lot of blood into that genitalia region, you need to drink a lot of water. Sometimes patients will say, oh, I get a headache, or, oh, I feel kind of drowsy after taking the medicine or after sex. And I'm like, did you drink enough water before?
Did you drink enough water? You have to drink water before and after sex.
Exactly. And usually the response is, no, I didn't drink enough. So always remember your hydration status in general on a day-to-day basis, as well as when you're getting in the mood.
Yeah, check out your hydration status.
Something that we've been working on really well, by the way. I'm very proud of how much water we've been drinking.
This was actually a goal for us, 2024, was to drink more water, and we achieved that.
Yeah.
Really good. Really proud of us.
Yeah, and we used to drink a lot of bottled water, unfortunately, which we've completely transitioned over into our cups with our ice and our straw. And actually, that's made a huge impact on how much water we drink. When you're limited to that small bottle of water, you drink it and you think you're good enough for maybe an hour or two. When you have a cup that you're constantly refilling, you just keep more coming.
And when it comes to lifestyle changes, how does exercise help our libido?
Right. So exercise is going to help impact our physical health, our mood, our self-esteem, our hormone production, our blood flow. So all these important ways to really enhance and support a healthy sex drive. Of course, again, exercise is going to increase blood flow to all the sexual organs and the genitalia to ensure that it's all able to maintain its rigidity for us to create and maintain an erection. That's going to further facilitate us to have a better sexual experience, which then again feeds into our self-esteem. Clinical evidence does show that people who exercise more often do tend to have higher self-confidence and higher self-esteem. So again, that adds into our sexual arousal state, making us have a higher sex drive. We know exercise is going to be fundamental in how our body's able to create and maintain our testosterone production. So all these ways come together to allow us to support our sex drive by making sure we are getting enough exercise throughout the week.
What about sleep? Does sleep impact our sex drive?
So as you know from one of our previous videos, sleep is very influential in our testosterone production and how our hormones are maintained, especially end of the day, first thing in the morning when we're having our peak of testosterone being released. So we do know sleep is very important with our sex drive. Again, the hormonal component is there, but also sleep is essential for our body to rest, recover, rejuvenate. It's where a lot of those recovery processes take place. And so it is crucial that you have adequate sleep, at least 7 to 9 hours a night. That allows your body again to rejuvenate and keep those hormones produced at an optimal level. We do see a clinical correlation for those that have insomnia or difficult time maintaining their sleep, that there is a tight correlation that they're going to experience symptoms of low testosterone, erectile dysfunction, a lack of sex drive. And so, yeah, there is a tight correlation there, and ensuring you have healthy sleep habits and healthy sleep hygiene is going to be essential in maintaining an optimal sex drive.
Rest, recover, and rejuvenate. I like that.
Yes.
It's very important.
Very recovery.
Very super recovery.
Very important.
So what happens when dietary and lifestyle changes don't improve our sex drive?
Right. So there may be something bigger going on. It could be something more complicated. Maybe there's a medical condition for your underlying lack of sex drive. Of course, you want to also consider what other symptoms you may be having. If you have symptoms of low testosterone, like a lack of sex drive, poor concentration, some weight issues, maybe you're feeling like your energy levels are lower, you're noticing it's more difficult for you to stay motivated, maybe you're not able to maintain your lean muscle mass or have an increase in body fat, all these things can come together. Maybe you have a few of those symptoms, maybe you only have one or two, but do consider the fact that there could be a testosterone deficiency or a problem with your hormones. Consider getting screened with your local primary care doctor or with a doctor that you trust. Of course, testosterone is one of the main reasons why our sex drive can either be high or low. And so addressing that concern will at least alleviate that as a possible cause. If you do have low testosterone, you consider talking to a doctor and starting something called testosterone replacement therapy, which is a medical intervention that can optimize your testosterone and improve these symptoms. And then there's also other medications you can consider. Some patients try ED medication like sildenafil, the generic version of Viagra, or tadalafil, the generic version of Cialis. These can help you more easily achieve or maintain an erection. And so this can be helpful in order to try and build on your sexual appetite or your sexual function. Of course, if you're able to have more sex, sometimes this can feed into increasing your sexual appetite or your libido. So that's another alternative to try. And of course, talk to your doctor, see what's appropriate for you. It's going to depend on what your medical history looks like. It's going to depend on your symptoms. And that's going to give you the best next step to determine what's going to be the most appropriate medical intervention. But certainly, if you are feeling down because you've tried, diet changes, increased your exercise routine, mindfulness, or stress relief, and you're still having a poor libido, talk to a doctor. There's definitely other alternatives that can help.
And check your T levels.
It is important to know that ED medications are not going to impact your sexual arousal, though. They're not, some sort of medicine that is intended to improve your sex drive. They can just, in a secondary way, try to enhance or improve your sex drive.
So they can help you build confidence.
Right. So if you're able to maintain or achieve an erection easier, that's going to make you feel more confident, which can thus help improve your sex drive.
All right, let's talk about some misconceptions and myths. I love this part.
This is a fun part.
This is when we discover and
yeah, I get to say no a lot.
You get to say a lot of no's.
A lot of that's not right. Absolutely not.
False.
Not true. False.
Mm-mm.
But occasionally there's a true myth.
Sometimes. Rarely.
Eh.
Is it true that only older men struggle with low libido?
I wish this was true because I've had low libido in the past myself. So absolutely not. Low libido, poor sex drive can happen to anyone at any age. There's many different reasons it can occur as well. So first of all, if you are younger and you are having these symptoms, you're not alone. That's completely normal. And many people your age have this issue. The most important thing is to determine what the cause could be. Of course, we want to look at your hormone levels, your diet, your exercise routine, any mental health concerns, stress, anxiety, as well as your medical condition. So talk to your doctor if you are younger and still experiencing symptoms of a low sex drive, because this is not something that only older men experience.
Is it true that masturbation negatively impacts male sex drive?
Right, so this is false. So there's no clinical evidence that masturbation has any negative impact on your libido or sex drive. In fact, masturbation can be extremely healthy and a great way to maintain your sexual appetite and your sexual health. Of course, anything in excess can cause damage, so excessive masturbation certainly is going to make you have a decrease in the willingness to be able to perform, because if you do it multiple times a day, you're going to be tired. Yeah, and we do have a refractory period as men. There is an amount of time after we climax that has to pass before we're able to do it again. So in general, healthy masturbation is great. In excess, of course, not so great.
Everything in balance.
Everything in balance.
Secret of life.
Absolutely. Nothing in excess.
Is it true that herbal supplements can cure a low libido?
Yeah, that's a great question, because there are many different herbal supplements out there on the market specifically targeted to try to increase your libido or your sex drive. But unfortunately, there's no clinical evidence to support that any type of supplement can increase or improve your sex drive or libido. It's also important to be aware that these supplements are often not regulated by the FDA. And I'm not saying the FDA is the best regulator on the planet. I'm just saying it is a body that is responsible for making sure that something is inside the supplement that says it's there. And unfortunately, most supplements have no sort of screening process. So just be aware that there may be things inside some of these supplements that shouldn't be, and there may be things that are supposed to be there that aren't present. So I am just a little weary ever trying to recommend someone to take a supplement, especially for sex drive, because there's no evidence that they're beneficial or helpful in any way.
Only if it works for you.
If it works for you though already, absolutely. I'm not here to tell you otherwise. Do your thing.
Do your thing. As long as it's working for you and you're happy with the results. And
yeah, do your thing.
Is it true that a healthy sex drive means wanting to have sex all the time?
A healthy sex drive means having a balanced and natural desire for sexual activity. It doesn't necessarily mean that you want to have sex constantly. Everyone's sexual desires and needs vary, and what's important is feeling satisfied and fulfilled in one's sexual life.
Satisfied and fulfilled. That's how I feel right now after this great discussion, great topic. This is obviously one of my favorite topics. Obviously, sexual health is the theme of our
Yeah.
channel and our videos. So thank you for answering all those questions.
Yeah.
I feel
Completed,
galvanized,
fulfilled. Yeah. And
satisfied.
thank you all for joining us. This is always so much fun to have these discussions with you. Of course, many patients of mine have brought this to my attention. And so I wanted a way to broadly be able to explain some of the things that I know and some of the things that patients have reached out to me about. If you have additional questions or concerns,
Let us know in the comments, please.
Absolutely. Anything that's related to this topic or a future topic that we may be able to review for you, happy to do so. Please like, subscribe,
Share,
drop a
comment.
pin, screenshot, donate, tag, whatever you're supposed to do to keep us coming back for more. And hopefully we will see you coming back for more next week. We look forward to
See you in the next time.
meeting you then.
Yes. I'm going to say it again because I think I can do better.
Just going for the Oscar.